Hi, this is Dr. A. In this video, we're going to look at the diagnostic and therapeutic procedure for blood. So first, let's start with the clinical laboratory tests that pertain to blood. So there are a lot, and we're going to look at the ones that assess the blood, the formed elements, etc. So we have the hematocrit, also abbreviated HCT, or sometimes referred to as the crit. And it measures the volumes of red cells as compared to the total volume of blood. And so it's a percentage. So, for example, it would be normal to expect hematocrit, especially in males, to be about 45%. That means 45% of the volume of blood is red cells. Hemoglobin, also abbreviated as HB, measures the amount of hemoglobin that's present in blood. It's a concentration, and so it's like all of it contained in the blood, but we usually release it from all the cells and then measure the concentration. The platelet count, it determines the number of platelets per certain volume of blood. The prothrombin time, also known as the ProTime or the PT, it measures how long it takes for blood to coagulate and form a clot. The red blood cell count, or RBC, measures the number of red blood cells in a set volume of blood. And a complete blood count is a set of tests that will include the red blood cell count, the white blood cell count, the hemoglobin, hematocrits, and all of the red cell indices, which aren't listed here, and the white blood cell differential and the platelet count. And so it looks at all the components of blood. It is one of the most often ordered clinical lab tests. So the red blood cell morphology is a test, usually part of a CBC, where you will examine the red cells for their abnormalities in shape. So, for example, we refer to in the signs and symptoms video and pathology video, refer to sickle cell and red cells that had a sickle shape. Well, that's something you would observe when you observe the red cell morphology, and you would note that in the report. So the white blood cell count, it measures the number of white blood cells in a set volume of blood. And the white blood cell differential, it determines the number of each variety of white blood cells. So if you go back to the anatomy and physiology video of blood, you will know that there are neutrophils, there are lymphocytes, there are monocytes, there are eosinophils, and there are basophils. And the white blood cell differential will give you the percentages of each. And so normally, let's say 60 to 65% neutrophils, around 30%, or 25 to 30% lymphocytes, 10% or less monocytes, and then usually 1 to 2% or less of your eosinophils and basophils. And then the erythrocyte sedimentation rate, also referred to as a SED rate or an ESR, it determines the rate at which red cells settle in a test tube, and if there are a lot of inflammatory proteins present, so if there's a lot of inflammation, those proteins will make those red cells settle a lot faster, and you will have an elevated sedimentation rate. In the medical procedures, we have a bone marrow aspiration. So a sample of bone marrow is removed by aspiration, and it's examined for diseases such as leukemia and aplastic anemia. So this is something that's necessary to go see what's going on in the bone marrow, because what's going on in the bone marrow isn't always reflected in the bloodstream. So we can't always determine that from a blood sample. The most common sites for bone marrow aspiration are the sternum, which is the breastbone, and the hip bone. And then phlebotomy is incision into a vein with a needle. It's a puncture into a vein with a needle to withdraw blood for testing. It's also called venipuncture. And so that's what we do to get blood samples. Let's look at some therapeutic procedures. So an autologous transfusion is a collection and storage of the patient's own blood prior to actual need. This is often done if you have a scheduled surgery and there's obviously enough time first, and you may go donate in the weeks leading to the surgery, and then they can save, keep that blood for you in case you need it. Blood transfusion is the artificial transfer of blood into the bloodstream. So usually it's from a donor, but you can have an autologous transfusion, so from yourself. A bone marrow transplant, or BMT, is when the patient receives bone marrow from a donor after the patient's own bone marrow has been destroyed. This is sometimes due as a treatment for certain leukemias, where they give the chemotherapy to wipe out the bone marrow, so we destroy the cancer-producing cells, white cells in the bone marrow, but then we need the bone, we need the immune system, the bone marrow, etc., and so we transplant a donor bone marrow. A homologous transfusion is a replacement of blood with blood from another person, and we call this also, it's like allo transfusion. So that one is, so that's what is normally done. So if you go donate blood and it gets used in a hospital with somebody else, that's a transfusion as it normally takes place. A packed red cell is a transfusion of only red blood cells without plasma. There's a little bit of plasma, of course, in there to suspend it, but when you donate a unit of blood, it can be separated into different components, and so the cells are concentrated and some of the plasma is removed and it can become fresh frozen plasma. Plasmapheresis is the removal of whole blood that's followed by the separation of the plasma from the formed elements, so from the red cells, white cells, and platelets. The formed elements are returned to the patient with donor plasma, or with, or simply this is a way to donate plasma, and you can just return the formed elements with, some saline or something, and it goes through the machine, it comes back. And then, so then you have plasma that can be given. We were doing some of that for COVID patients to help them recover. And you can also do platelet pheresis, where it's removal of whole blood, and then we separate plasma and platelets and return the white cells and the red cells to the patient, the donor. And then whole blood is a transfusion that would be a mixture of both the plasma and the formed elements. That's rarely given. We rarely give whole blood transfusions anymore, but whole blood would be all of the elements. Now, when you donate a unit of blood, then that unit that they're collecting from you at that point in time is a unit of whole blood, but then it gets separated into its components. So let's look at some blood pharmacology. So an additive is, it's the sum action of two or more drugs given to a patient, where the total strength is equal to the sum strength of the individual drugs. There are also blood additives that are put into blood units that help preserve the blood. Contraindication is a condition in which a particular drug should not be used. A drug interaction is the alteration of the effect of one drug by another drug that's taken at the same time. And potentiation is the use of one drug to boost the effects of another. The total strength is greater than the sum of the individual strength, so it makes it stronger, or the effects stronger. A anticoagulant prevents blood clot formation. An example would be warfarin or Coumadin. Antihemorrhagic prevents bleeding, like Amicar and vitamin K. An antiplatelet agent interferes with the action of platelets, and this is usually done to prevent blood clots. So this is Plavix, for example. Fibrinolytic dissolves existing clots. This could be given if the person has had a heart attack and there's a blood clot in the coronary artery. And examples are Activase, tissue plasminogen activator. And a hematinic, it increases red cell or hemoglobin, like Procrit or Aranesp. So this is to stimulate the bone marrow to produce more red cells or more hemoglobin. So All right, that wraps up our blood pharmacology and our therapeutic procedure and diagnostic procedures for the blood chapter. Thank you.